Thank you all for joining us for this Manuthera webinar. My name is Vili Rahkonen. I'm here with Mr. Hakim Hassan. And today Hakim is going to share you the best practices on how to utilize Manuthera with different kind of patients. Hakim has a long experience with different kind of patients and on how to get by with them. Without further ado, please, Hakim, the stage is yours.
Thank you. Hello, everyone. My name is Hakim Hassan. I'm an osteopath by profession. I've been treating patients since 90s. It's quite a long, many years of experience. I have experience with many patients with different problems. And some patients are acute pain they are coming with, and some patients are coming with a chronic cold problem. With the assistance of Manuthera 242 is the most versatile treatment table in the world. I have discovered with a number of years working with different treatment table, this is by far the most helpful treatment table which assists you in taking care of yourself as a therapist and also assisting you to achieve the best treatment result at the end of the sessions. We will cover a range of all type of problem which is very common, starting from the cervical neck going all the way down. We're going to discuss about the common reason of pain, and all this put it together, we try to find that at the end of the result is the patient have to have a better outcome from the treatment we're going to be demonstrating today. For example, we have a lot of patients who come to you with pain. At the end of the day, we need to understand what is the cause of the pain. There are so many reasons the pain will show up. It can be due to muscle stiffness or muscles imbalance. It can be due to joint malfunction or alignment. It could be also due to blood circulation and oxygen deficiency in the tissue. All that produce pain. So with the Manuthera 242, it helps us to find the main root of the problem. For example, I am going to start with the low neck problem, which is very common, or the middle section of the neck. I have many patients who come to me and say, I have a very stiff neck, and then my first question is the pain radiating to the arms, numbness or tingling, to determine whether I am going to be focusing on mobilization of the neck, or I'm going to focus on muscle treatment, or maybe it's a combination of the two. So in this case, let's assume that this patient have a problem in stiff muscles with minor discomfort shooting around the shoulder. So my first thing is to palpate and try to find what can I do to find the problem existing in his neck. Now, by moving laterally, I can sense and feel each and every segment, how to respond to my movement. We should remember that the neck muscles are very strong, but at the same time, they have to remain flexible. And that leads to, first I need to identify what is the root cause of the pain. Once I find out the root cause, it's stiffness and maybe the joint which are not moving freely, then I need to think of the second phase, which will be how to approach and what treatment should I do. But before I go far, I have to make sure that this patient, for example, did not produce all the symptoms which are acute herniation of the disc, because I cannot do the mobilization once the patient have a disc herniation and it's acute. So that will be on the manipulation, avoiding the mobilization. So we're going to start with how do I treat my patient when they have mechanical pain, which means muscle stiffness or tightness, which means the mobility of the joint deficiency in mobility, and all these things together, how do I approach it? So the first thing, I'm going to lift this particular part of the armrest and just get the patient to be in this very comfortable position. Then from there, I have exposed the position of the neck to be more free. Once I get this particular position, then there is a little bit of movement which I need to change to put the neck that is not the extension. There is no extension. So this is much more comfortable now in this particular case. Then I need to adjust the height to myself to make sure that I'm also very comfortable when I'm doing the treatment. The next phase is to activate the lateral movement and make sure that, because the neck is very sensitive, how I'm going to mobilize the facet joint while I am stretching the neck. This technique works extremely well, and you can only achieve it with Manuthera 242 because it gives you a range of movements and also a specific distance and speed which you could control. And once I found that the patient, they're also complaining of neck muscle pain, I can just add lateral flexion when I'm doing a deep tissue massaging. This helps a lot to remove the stress within the muscles while there is also lateral flexion on the facet joint. Then I'm going to go into the lower part of the neck, which is the first rib and C7. By combining this particular movement, so I am compressing the rib number 1, and I'm also stretching the cervical number 7 and giving a nice stretching on the neck muscles. Once I'm done, I can do it repetitively to the next one. This is very effective how to mobilize your spine without straining your own back. From here, I put the position back to where it's supposed to be in the center. Then I can just think of what is the next best approach on this particular movement. So I can ask the patient to lift the head a little bit and then turn. This particular position now is going to be very, very useful when I am mobilizing the facet joint. So in this particular case, I am going just a very small, because I'm working on C1 and 2. So one hand is fixing and the second one is rotating. So this will give me a range of a small extension of the neck, but there's also rotation because the head is already rotated to one side. This angle is very effective, and you have to be very, very gentle and make sure you communicate with the patient all the time, because this helps that he's not feeling any discomfort whatsoever during the treatment. But this particular approach, let's put your head back. This particular approach, you have to be careful that is not for patient with herniation of the disc. It's more for the patient who have very stiff neck muscles and also where the joints are not mobile the way it should. And then I can also travel much lower from the C7 to T4 by adding a lateral flexion, which is a small mobilization, and stretching this particular upper thorax and the lower cervical section, adding a small mobilization. This movement has to be done very, very gentle, using enough pressure, but without causing a discomfort to the patient. And then you have to repeat it, of course, on the second section. And by adding all this kind of rotation, lateral flexion, it's a very, very good tool for patient how to loosen up the tension in the neck and the cervical region. So this is one way to approach the cervical problem. Now I'm going to demonstrate other way to do it on opposite direction. So I will request this gentleman to turn around and lie down on your back. Again, it's very important to make sure that whenever you're doing the treatment, you have to make sure that the patient are very comfortable. And I want you to come a little bit upward a little bit. Yes, so the comfort of the patient have to be treated as a priority also. For example, if you see that there is a little bit of a gap there, so I can close the gap and make sure that he is very comfortable in this particular position. So the next approach is going to be turning the head to one direction, 45 degrees, and palpate and identify specific point. For example, now I'm on C1 and 2. So I can mobilize it very gentle, going downwards, and try to make sure that you don't approach the front part of the neck, just making sure that you're mobilizing the facet joint, and also you are massaging gentle those muscles which are problematic during the head rotation. Then of course you have to repeat it to the next part, 45 degrees, and a very gentle rotation, lateral flexion. This will allow the facet joint to move freely, and it will allow also the blood circulation and release of the tension. So let's think about the patient who come with a herniation of the disc and it's acute. You're not supposed to be doing all this because in acute stage, there's a lot of inflammation, there's a lot of muscle spasm, there's a lot of pain. So in that case, I prefer just straight to go to adjustment of the cervical spine on the specific level. But in the same time, I also want to make sure that which level the patient is causing the pain. If the patient will come and say, I have back pain, I have neck pain, but I have also a numbness in my fingertips, which are these three, probably if you look at the anatomical chart, you'll find that the cervical C5 and 6, which patient will have these three particular numbness. And if it's on the second two, it would be the ulnar nerve, which is on the 7th level. So in that case, I'm trying to be sure that asking the patient which particular place which is experiencing the numbness, that I'm going to go on the specific manipulation. Let's say the patient say it's my these three fingers, then that guide me to understand probably it's on the cervical number 6. So I need to do the adjustment of the neck and be on the specific point. If this is the hand which is experiencing the discomfort, the manipulation have to be done only from one angle, not on both. So in this case, I am going to hold his position in this way and find first locate where is the cervical 6 which is complaining of pain. So let's say I have discovered that this is the joint, then I need to adjust it gentle in that case. So I can be on the specific exactly in that. So then once you're done, you can just give it a nice massaging to release the tension. And then I need to think about the traction. That traction is going to be used to release that pressure. Now the facet joint is open, the muscles has been worked on. Now the next phase is going to be the traction to release more tension in the deep muscles. So then I'm going to activate this particular knob, which give me the traction of the neck. But again, as we remember that the neck have to be, when you do traction, it has to be on the straight line all the time. So I have activated this particular place. Now I need to know the next step. So I'm going to lock up my fingers in this particular way to the chin and make sure the chin is tucked down. And also I am not touching his throat. By holding the position and also adjusting my back, then I can get into this particular traction. Is very helpful when somebody have a herniation of the discs, and that release the tension on the ganglia of the nerve root, and that will support the healing process and also removing the excess fluid in the facet joint which is causing pain. Once you're done, then make sure you lock it back and then make sure that there is no issue with the neck. This is the best approach when it comes to Manuthera. It assists you all the time with the tool. Instead of having the harness to pull, instead of having additional equipment for the neck traction, this is combined all in one. Then from there, we're going to start thinking about the second part, which is very common on the middle section of the upper back. So I will request this gentleman to turn around. So you need to make sure he is comfortable. And then it's the first one. So again, everything we do, you have to make sure that the patient comfort comes first. It's not a good experience when you're having a treatment and the patient is not on his best comfort position. So I have to adjust this treatment table to his comfort and also to my comfort and my safety. Now, before I start into treatment or mobilization or anything or adjustment, I need to think about this particular. So I have cases when many patients suffer from the upper thorax stiffness. And most of the people who works in the office, because of the computer position, because of the head position, there is always stiffness on the upper thorax due to sitting long hours. Now, when somebody have upper thorax problem, hardly any accident or injury from this particular area, but it's to do with the static of not having enough mobility. That leads to muscle stiffness and contraction, and it develop a chronic problem. Now, in recent year, we have experienced coronavirus, and this has changed lives. This has made lives really, really bad, and people are so much suffering because of additional to the stiffness being in the office, children being in school, sitting at home now. So there is lack of mobility anymore in this particular. So we have seen the increasing. I have a number of patients who are coming to me after suffering with coronavirus. Now we know that this virus attack the breathing mechanism. While you're breathing, you need the intercostal muscles. Now those intercostal muscles, they are giving you the inhale and exhale. So during those people who are affected by coronavirus, it leads to lack of breathing. They have difficulties in breathing because there's a lot of contraction in those muscles. After they recover from the virus, they don't have enough expansion, and also those muscles has been under restriction of mobility and elasticity to the rib cage expansion. That create longer recovery because they need to exercise in breathing. How do we assist those people? Luckily and gratefully, Manuthera 242 is the only treatment in the world which cover the mobilization or the mobility of the upper thorax. Majority of all the treatment table, they are static, but hardly any which will help and assist how to open up the rib cage movements. Now, how are we going to demonstrate that? And what's the benefit? Is to first of all to make sure that the facet joints, each and every vertebra, has to have enough movement within. And then the rib cage attachments also have a mobility to it. In between the ribs, you have also muscles, intercostal muscle, which are part of the whole thorax mechanism. That itself requires enough mobility, enough stretching. So I'm going to demonstrate how it's going to work. First, you have to go very gentle, palpate, try to feel which segment doesn't have enough mobility to it. Once you identify the stiffness and which region, you can think of their muscle attachment and what will be your hand position. So, for example, this is extremely well to start with, very gentle, asking the patient to breathe calmly and try to follow the rhythm. This will assist how you're going to stretch all those muscles and how to stretch the ligament within the rib cage. This particular technique is very useful to start opening up the joint first, and then we go soon into the between the ribs. This is the first approach I'm going to go for. And then the second thing, remember to do both because they are all part of the rib cage. You cannot mobilize one side and ignoring the other side. So you have to mobilize both. Now in this understanding and being in your mind, so I'm going to add about 10 degrees tilting, and this tilting will help to assist how to work also on these muscles. So in this case, I can start rotating gentle, stretching the ribs. As you can see, there is movement in the rib cage. And this is what was missing during the coronavirus recovery. You don't have enough mobility in your rib cage. So this technique works extremely well to help the patient breathing better and recovering much faster. Now, the other approach is it's all depend on where you hand position. For example, on the rib number 5, I can come close to the spine and mobilize that particular rib, moving on the rib side and also the costochondral joint, because that's where the mobility will come from. Adding a minor pressure, then moving towards the whole region of the ribs. So expanding the ribs and stretching the muscle in between. This technique is very, very helpful. And then we're going to go now into how do you combine all the three together. Lateral flexion, I'm going to add extension flexion, and then also I'm going to add rotation to it. All this is to make sure that the facet joints are mobile, the ribs are stretched, the intercostal muscles are also stretched. All this will assist in mobility and breathing. So from here, I am going to activate the flexion extension movement. I can start also to palpate and try to feel if there is any restriction within segments of the upper thorax. Once I find that the whole system is very stiff, let's say, then I can go one by one, adding rotation and flexion at the same time. I will ask the patient to breathe calmly and follow my movements, and also to have enough, if there is any restricted area or any place which he is not comfortable with, I will be asking him to identify those particular segments, so that will help me into focusing on those particular places. So as you can see here, I am adding lateral flexion, extension, and rotation. So this particular movement will help to recover from all the breathing problems you're experiencing due to stiffness of the rib cage, and also the pain you're experiencing during the recovery. Once it's over, and then start to think about the next part is the muscle direction. How do you stretch all these muscles? So in this case, again, I'm going to focus on the muscle. This technique, you're compressing the rib and also you're stretching the muscles. This technique is really, really important to be able to breathe freely without any restriction. And you have to go very gentle, because at the end is how do we increase the range of movement in the joints, and how do we increase the elasticity of the muscles, and how much we're creating space that when you're taking a deep breath, the lungs has ability to expand and more room. That will depend on the mobility of your spine. Thankfully, to this particular innovation of Manuthera 242, it has created a way that this particular problem can be solved. In so many years has been no proper way to do rotation or flexion extension of the spine manually. With the assistance of this treatment table, it does help us to make sure that the whole system is covered. Now, from here, we need to think about something else also. We have patients who have, let's say, scoliosis. Scoliosis, it's a deformity of the spine or the curvature, either grade 1, 2, and 3. Now, because of the nature of the spine curve, we cannot change that curve, but we can encourage each and every segment to do its share in mobility. We cannot change the curve, but we can improve how the mobility of each segment. That helps a lot, that the patient are not restricted to certain activities. So how do you do that to try to create more traction? I am going to add a little bit something else. I'll ask this gentleman and make sure that there is safety required in this particular position. So So I am going to tie him a little bit on the safe, to be on the safe side. And in this harness will help to increase the range of tilting. So now I have added more traction in this particular area. This will assist the gravity that we can now work and how to mobilize those particular joints. So by activating this lateral flexion with assistance of traction, so I can add more movement. So for patient, I have a lot of patients with scoliosis cases, problem. They feel very comfortable when I use this particular technique because they feel for the first time that there is movement in the spine. So this is how you can ease the stiffness and discomfort of the patient with scoliosis cases, and also the compression of the facet joint. Remember, it's important to use a very gentle speed which the patient can follow, breathing safely. And by doing so, you will get much more better result when the patient are feeling comfortable. You can use a different method. You can either do this way, whichever works for you, that's all fine. I prefer this because I can put my knuckles on the rib line to stretch when I'm doing rotation. Like now I am between two ribs. So this technique, it really helps to find the exactly target I'm looking for than just having a full hand. So this is the way I will approach this particular problem. Then the other way I will do is to stretch the side of the ribs right there. This technique, it helps a lot when somebody have a very stiff back or breathing issues. And many times you find that there's so many muscles like rhomboid muscles, major and minor. You have the trapezius muscles. And how do you get into those deep muscles without having a discomfort? So all these techniques can be achieved with Manuthera 242 with assistance of the angle. It gives you much more benefit of having the right tool to mobilize the spine in this way. Then we're going to start thinking about the other common problem, which is low back problem. There's a lot of things to follow, but again, we have to take into consideration, for example, 70 to 90% of all the cases of patients who come to the clinic, they are suffering of low back pain. Now, all this kind of thing now, we need to think about, can you only focus on one place? In my opinion, I think the best way is to think about how to release all the tension. Is either through mobilization and manipulation. Now, let's think about manipulation while we're still in this area. The common way to manipulate the back is either you go and thrust it, but I prefer, and I found that this technique works extremely well. When I activate the lateral flexion, I can actually mobilize it this way. So it's very gentle while I'm applying pressure, and at the same time, I can also add thrust when I'm rotating, so it's going to be that way. And this particular rotation thrust is very effective, and then you have to repeat it on the other side. So in this case, you did the mobilization and manipulation. I found that instead of doing more all at the same time, I prefer to do one at a time. So rotation and you strike. And again, you're striking with this hand because the rotation is towards the left side. So you open up the area first and then you strike it. So this is the best technique. I found that it works better. So you're striking with only one side, and then you have to repeat it and do it on the other side. So now, we're thinking systematically. When I do the back treatment, I really prefer to take care of the whole back as one unit. Some people say, yes, by my upper back. I say, well, without low back problem, this low back problem can also be part of so the pain started here, then it traveled up. But sometimes the pain can be from the middle. It's also caused the low back pain to be problematic too. Or it could be the neck causing whole chain reaction to be out of place. So we move forward to the next one. The next one I'm thinking about between T11 or T12 all the way down to the lumbar region. Now, what are the common problem in the lower back? Majority of everyone have a lower back pain once in a lifetime or even more. Some people have a chronic back problem. The common problem I found that it starts most of the time with muscles not getting enough oxygen due to sitting, due to bad posture. That will lead into muscle starvation of oxygen. Once that happens, the muscles start to go into contraction, and that leads to a problem that the whole mechanical system start to fail. The next step is going to be either the facet joint get locked or start to lose its range of movement. When that happens, people will start complaining of back pain. It used to be very gentle, now they feel like the pain is increasing. Now we need also to remember that the discs, they are between the vertebrae. They are supposed to work as a shock absorbing mechanism. Now once the muscles are deoxygenated, once you find the facet joint are starting to get stiff, then the load and all the pressure will be accumulated on the disc because there is lack of mobility to it now. It's almost like having a car, you want to drive and you forgot that the handbrake is still up. So there is one part say let's go, the other part say no. That particular conflict will cause a lot of pressure to the disc, and then the reaction of that is going to be the facet joint locking up, the proprioceptive nerve become irritated, and then patients say, I have a back pain. It started very gentle, now I feel it's getting worse. And if it gets worse for a long time without taking care of that problem, it leads to either the disc now is bulging, it's starting to press the exiting root on the foraminum, and people start experiencing the pain radiating down to the leg. So these are very common. So most of patients will say one of the three things I mentioned, whether started on the muscle or the joint block or the sciatic nerve starting to react. These are all part of the lower back problems. Now, when you're going to approach lower back problem, you need to think about not one place, not the adjustment alone, but you need to think about what happened to that capsule, what happened to the deep muscles, what happened to the well-being of the whole synchronizing mechanism of your muscles. That leads to, you need to pay attention on all of them. So I am going to start very gentle. I prefer to start from the top going inward or downward, which means the top is the muscles. So I'm going to start activating this lever and start to stretch very gentle. This is when the patient are coming to see with all the problem, not acute problem. When somebody have acute problem, I prefer straight to go to manipulation without mobilization, without stretching, without massaging, because that can cause more inflammation. So a very gentle side stretching the muscles. This is very helpful. And also you need to communicate with the patient how much pain they're feeling when you do certain things. How far can I stretch and they can handle it? And then you go to the next section or area, you do the same, communicating with the patient and try to find out how much can they handle. After pumping it for about 10-15 times, the pain starts to get less because the elasticity of the muscles, the blood circulation is starting to increase, and then you start to feel like now there's more elasticity starting to come in and the less pain you feel. Then the next thing you need to think about now, which level, because the patient, they say, it's my lower back pain, but which level? So again, we can palpate, finding one at a time, which segment causing pain. So you're asking the patient to identify and inform you which one hurt most. In this case, let's say maybe L4 and 5. Then you have to start stretching a little bit and feel if that's one, and move up a little bit and ask them if the pain is the same. That will lead you to maybe this is less painful, but the one in the bottom is more painful one. So you already identified the target. And then you start to think about how you're going to work in those particular levels. So once you're done in this part, then we identify, let's say, L4 and 5, because it's also very common. And then you can start gentle mobilizing this particular way. This mobilization is very effective, but remember, this patient came with back pain. You don't start on a full range. You start maybe on 10 degrees and maybe 5 times pumping it this way. And if they don't feel so much pain, you can increase the range of movement to maybe another 10 degrees extra. This helps a lot to create more elasticity to the QL muscles, to the deep quadratus lumbar muscles, and also the erectospinae and multifid muscles. And then you have to repeat it on the other side. All these are part of preparing the next step. Now, what will be our next step? So the first step was to handle all the surrounding muscles. The second step now is a level 2, which ligaments. Now, in the ligaments, you need to think about 3 ligaments. The first one on the spinosus is called supraspinatus ligament, which is between the facets. And the second one is going to be the interspinatus ligament, which is between the spinosus. And then the third one is going to be the one which is flavum ligament. Now, when somebody have a low back pain, we assume all those ligaments now they are really holding the process. They don't allow the mobility, and that's where the pain is also coming from. And the common cause of ligament pain, it's really, really short and sharp pain. So in this case now, we will start working on, remember the ligament between the process, they are very small. So I prefer to hold the position, find it, and then just use a very gentle but very specific and hold it for about a few seconds and release. And then hold it again and release. This approach, it helped to stretch the ligaments, and I'm focusing on those 3. Supraspinatus ligament, interspinatus ligament, and flavum ligament. And then, remember also to start thinking about the sides. You can add a small lateral flexion movement. So in this case, I'm moving from the center towards the right. This will create enough stretching. But remember, don't go too far because there's pain going on, and you want to introduce that every segment has been treated. So depend on how much pressure you're applying and also how much the patient can handle. So once you get into all this deep ligament stretching, this will assist to increase the range of movement, because some patient came to you, they cannot bend forward or they cannot get up from sitting. So this particular information that we want to synchronize the whole structure to be able to correspond between the ligament and muscles, and also between the muscles and the nerves. So making sure that there is all the ligament has been taken care of. When you finish, and then you have to think about the third position. So we started on the muscles, upper layer, and then we moved into the ligament. Now we need to start thinking about how to approach the disc itself and how to reduce that pressure from the disc, because it's level 1, level 2, and 3. So the disc will be on the level 3. So how I'm going to do that is to increase the height a little bit and also the tilting. In this particular, you don't want to treat a disc which is under pressure. So we need to remove that pressure from the disc. So by doing that, I'm going to activate the tilting position. That will assist me. The gravity will assist me. So now this particular patient now is under traction. So once we create the traction, we know now that the disc it has less pressure because of the angle and because of the position we're using. So in that case now, I can try to locate and palpate this way to try to identify the sore spot. Once I locate, let's say it's L4 and 5, maybe 5 and S1, now we know the gravity is working towards the head. So I can assist it by adding a small traction. Now the disc is being stretched, allowing it more blood circulation, decompression, and also allowing the exiting nerve root to calm down due to the position changes. So in this case, I can just give it a nice stretch. This helps a lot to decompress the pressure in the discs, and that also allows the blood circulation and oxygen to increase, which cause less pain. Now, then from there, remember there are two facet joints on the right side, on the left side. So I can do that now by adding a small gentle rotation and traction. This is extremely useful when you doing lateral flexion plus the traction on it. That reduces the discomfort in the disc and allow more blood circulation, allow the metabolism changes, allow the fluid to go in, and also stretching the joint capsule. This particular approach, it helps a lot when you have a herniation of the disc, whether it's, remember it has to be a chronic or old one, not acute, because acute pain we don't do mobilization. It's going to be extremely painful if you do this kind of approach. So once you make sure that the compression is off, just remember the spinal cord fluid need to be allowed to move. So you can give it a nice movement that you allow the whole synchronizing the whole system to be to reach to the destination of the fluid. So from this point now, we already know that this is a decompression of the lower back. And again, thank God to this particular treatment table, you don't need another machine to do traction. You're using all of it in one. So and then from there now, remember we're talking about the ligaments and the disc, which are much deeper. So and then we're going to add a little bit of flexion. So this creates more traction again. And this traction is going to help to add more stretching. And then I can take all the pressure possible. Once I know the pressure is released, then I'm going to approach another angle. So let's put it back and then get him back. So again, because we're working on the same area, we need to do the rotation of the lumbar to reduce the pressure. Most of the time when you have low back pain, you also have the gluteus medius. You have also the QL, the quadratus lumbar muscle spasm, and also you have the SI joint, which is very common, this region to be in trouble. So I will ask this gentleman to come down a little bit. Very good. And then you have to make sure that you're working on the range where the ilium bone, that you have a good position. So from there now, we can add more, a different stretching in this particular mobilization of the back. So I am fixing the sacrum right here and then rotating the ilium bone. So literally you're doing, this is a natural position, then I can do this stretching all the deep ligaments. So by compressing and rotating at the same time, moving on the edge of the sacrum where it is located, and that's where the SI joint is located. So this particular technique will work extremely well when somebody have lower back pain and the pain is radiating toward the glutes, toward the piriformis, toward the leg. So you need to cover all those deep ligaments and also introducing lateral flexion and also at the same time taking the pressure of the joint capsule. This combination is extremely well, so you can make sure you can be sure that you do both sides, because remember this is the end of the spine and you're dealing with the upper bones, the bigger bones, which is ilium, you have the sacrum and you have the femur bone. All these are big muscles and also the bigger bone when they meet the smaller one on L5 and S1. So you need to create that particular angle. So once we establish that, and then we're thinking about what next. What is the second chain of, now we have completed the upper muscles, we have gone between the interspinatus ligaments, and then we just went into decompression of the spine in tilting. Now we're doing the rotation of the SI joints, And finally, we're thinking about also what else is causing this back pain. Traction. So there are some patients, for example, the older patient, which they don't like to be put upside down because of the blood pressure, because of any other reason, they cannot be into that particular position. So what you can do in this particular case, you can make sure that it's level, and then you go into traction. So you can assist doing traction by this particular movement. This will help to decompress the spine. It's the same thing as when you're tilting, but this helps more for those patients who are not able to be head down by going into the sacrum and a good traction and release. You need to control it that you don't go too fast, but at the same time, you need to make sure that you can feel the movement and how far can you push it and how much pressure you applying depend on the severity of the pain the patient is experiencing. Once it's over, then you can think of now the manipulation side, because we have covered the root cause, the common area, how to approach it all now on the manipulation side. So in this case, we will start with drop technique. Let's say if we focus on a person who cannot be twisted around or this, so we can go into the drop technique, which is this particular way. Now, the whole point of the drop is to release the joint capsule stiffness. It's part of manipulation. So this will assist you and will help you to get it done. Now, if you do it this particular way, you can strike both joints at the same time. So you really need to have a good position, and you need to connect this particular place on the left side or right side and the other one, so they are equal pain. Then you press. Then sometimes you need to repeat it. It's not always one, but it can be repeated a number of times, 2 to 3 times. So you just go in and just give it a good strike to open up those particular joints. Now, there are sometimes when you have a particular case that the patient maybe need a little bit deeper manipulation. So you can actually add traction to it. So you can go further down, because sometimes if the distance was not enough, you can add both. So you're going to apply the same force, but much more further out. So that will get also manipulation of the joint capsule plus the enough stretching. So it goes into that position. This gives you much more, a bigger range of distance, much more bigger distance in this particular, if you want to go further. Remember that 2 to 3 times is more than enough. Now, from here, we get into another part. I will ask this gentleman to lie down sideways, like that. I just need to make sure he's comfortable. And then if you can come up a little bit more. So in this case, so there's also another way you can mobilize the joints. And so I will ask this gentleman to be in this particular position and then activate this. So I will need your hand here, and I need it rotated a little bit. So in this case, I can work a little bit in this mobilization of this particular joint to make sure that if I can feel it, the movement, if it's good enough or not. This is excellent. So I can follow different facet joint to feel how the movements are responding. And once I feel there is a good mobility and there is not so much pain, so I can go back and put the whole treatment table in the position. And then I can start thinking of how to adjust his back. So I'm going to use this particular method, locating the L5 and S1, which is that particular point. And then from this particular angle now, I will be able to stretch it and allow it to be manipulated very gentle and safely. There. So now once you open it, and then you can either go back and do a minor mobilization to it and make sure that this particular joint is functional again. So once you feel there is enough movement, and then you can go to the other side. But it's really important to feel that there is enough mobility to it. So now I will ask the patient to go back to his stomach. Okay, back to the stomach. And then let's say, so just make sure again the position is correct. Then from this particular angle, I need to think about how about if the patient have arthritis in those facet joint. It's possible that one joint is a very healthy joint and other one is not, because sometimes you have those particular cases. So I prefer that if the patient have one particular joint which is healthy and another one is not, or both are not very healthy, I can take this particular lever to lateral flexion. So in this case, I'm opening up one joint and closing the opposite one. So in this case, you can either try to feel how the movement is. If the movement is not good enough, then you can add a small rotation in this particular way. And then you can think about how to manipulate only one particular joint without disturbing the other one. So in this case now, I am going to lift up a little bit this to make sure, because remember when the person have a radiating pain, you have to be paying attention on the sciatic nerve irritation. So by keeping the leg a little bit higher, that allows the sciatic nerve to be less tensed. So in this case now, I will activate the drop. So I will activate the drop, and I already opened this particular point. So my striking angle will be in this particular section or direction. So it's going to be particular specific force toward that. So it's going to be that angle to open up one specific joint, and it can be repeated a couple of times, and then you do the other side. So once this is completed, at least you return back, look up the position, and then you get this position back, and then allow the joint to calm down. After manipulation, this is very, very recommended to pump it a little bit to get all the position and the proprioceptive nerve endings to understand that now we're in the neutral position, so the healing process can take over. So we covered this particular area, how you can treat it. With a chronic problem, I'll insist again, it's just manipulation is very good. But for most of the common problem, it can be treated with this particular approach. The other part which we can think again, what is the common problem which are associated with the disc herniation or back pain? It's when you have a patient who are constantly bending forward. They just cannot get their back upright. It means the joint is open in flexion, but it doesn't want to go back to its position. So what can you do? In this case, because they're bending forward, but they want the joint to restore back to its position. So you start with wherever they feel comfortable. For example, they came when this is a position they can walk without ability to go straight up. Then you start from that point. You hold the joint and then start to stretch it, but going upward. So basically you're lifting and pumping it, but going upward all the time. So this will give a good extension because they were in flexion all the time. And now you start from here and give it a very small pumping, but going towards extension. This helps to restore that, because when the patient is standing, when you tell them to stand upright, it's going to be painful. But when you're adding this extension and pump it, and then again you're increasing the extension, this will help them to get back upright. In that case, we know that the range of muscles and movement is correct. So then I'm going to show you before we finish how, when those particular patients come and they cannot move, how do you get them out of the bed? So this will assist to give them a comfort they need when the treatment is done. So you make sure they're safe, because you don't want to irritate all the good treatment you have done. And then I'm going to find this particular angle first, and then we do the tilting. So the best way is to make sure that they are safe and they are able to get out of the bed walking. So this should be okay now. Okay, now you can walk out slowly. You can get up, and let's see how it feels when you get up. So basically this is how you can get up, and now you can come up again. If you feel okay, then we make sure that it's always more safe to make sure that the patient are not having this pain. And then finally, and we can get the patient back to neutral position.
Well, thank you, Hakim. It was a really nice lesson on different experiences you've had with your patient. I know that you could talk hours and hours, but yes, I just checked the time, and we've always done an hour now. And I want to thank you for joining us today, and for more content and for more information, more techniques from Hakim, please visit our Learning Hub. You will find more videos and different tips and tricks to how to utilize the Manuthera. And also, please share your ideas to us on what could we go through in our next webinars. And until the next time, thank you, Hakim, and to all of you on the other side of the screen, take care, and see you next time. Thank you.